Hello and welcome. I'm Kelly. We're going to be spending a little time discussing stem cells today. First off, I want to say thank you for taking the time out of your day to learn about alternatives to what you've been used to, medications and surgeries. First off, let me tell you a little bit about us. For those of you that have heard we are quote unquote a miracle clinic, I want to be perfectly clear. We are not performing miracles. As much as I would like to claim that we walk on water, I would be afraid of being struck down by lightning in front of all of you. But seriously, every time I hear a patient say this to me, I cringe because it gives us a bad rep. I want to make sure I clarify the only reason we've been able to help over 5,000 patients when so many of them were told by their doctors that they could not be helped is because when you go to the root of the problem, you solve the problem, right? That is not a miracle, that is simply called a solution. Our team, we have been committed to only investing in therapies that focus on the root cause of the problem. That's the difference between us and the rest. So what are your current choices to help with chronic pain? Knee pain, hip pain, arthritis. Any ideas? What are you currently utilizing? Medication. Question, does medication go to the root of the problem? No. So what is it that medication is doing? It's treating the symptoms. Many of the patients we meet are suffering with arthritis. If you're not dealing with the pain, you know someone who is dealing with this pain. And what is the most common treatment for arthritis today? It's medication. How many of you are tired of taking medication every day? According to a 2014 study, the Institute for Healthcare Informatics found that people ages 65 to 79 they receive more than 18 prescriptions of new drugs per year. NSAIDs. That stands for non-steroidal anti-inflammatory drugs. The goal of these is to reduce your inflammation. Has anybody ever heard of these? Of course we have. We get these all the time. But does anyone know the side effects? Things like stomach ulcers and bleeding, high blood pressure, fluid retention, kidney problems, heart problems. Let me ask you a question. Is the problem you're dealing with, is it a deficiency of Advil in your system? It's not. What do these medications do for what is causing your pain? Nothing. It masks the symptoms. It's only a Band-Aid. It does nothing to treat what is actually causing the pain. This is the cover of Time magazine. Can you see what the cover is saying? They ran a story on healthcare in America, and this was the cover story for that magazine. What the article says is from June of 2015 is that US citizens feel that we are over-medicated and that as a country we are taking far too many medications. All of these being recommended by our doctors. More importantly, there is an addiction crisis attacking society in America. How many of you feel the same way? According to a National Institute of Health study in 2014, the United States consumes 75% of all of the medication created in the world. But we are only 5% of the population. Let's talk about cortisone. What does cortisone do? Anybody know? Cortisone is an anti-inflammatory. So what does that mean? It reduces the swelling, which will also reduce your pain. Many people get relief from a cortisone injection. But one very important question, what caused the inflammation in the first place? The damage, the injury you have. And since cortisone doesn't change anything and the damage is still there, what eventually is going to come back? The pain. And did you know cortisone also has its side effects? Thinning bones, easy bruising, weight gain, higher blood pressure, cataract formation, thinning of the skin. More importantly, you can only have 3 cortisone injections per year to the knee. Does anybody know why that would be? Cortisone eats your joints. This is an actual picture of damage to a knee from too many cortisone injections. And again, what does this do to treat the underlying problem? Nothing. So next option is a total knee replacement. Some of you may have had this. To be honest, most patients are very glad they get this procedure. They're happy because their knee has deteriorated to such a degree that this is the right choice. And most of the time they get good results and great pain relief. But the question is, would you want to try something less invasive and possibly avoid needing this altogether? Despite patients getting relief, it does not come without its downsides. This is an actual patient who came to us, wondering if we could help him with his knee pain. After a knee replacement surgery, he had infection and other complications. 3 more surgeries later, he sure did wish he never went in for that little surgery. You would think because we have the most doctors per patient, the most hospitals per patients, and we spend the most money, that we would have the healthiest citizens, right? Where do you think we rank in health compared to the rest of the countries in the world? There's 195 recognized countries. We're not even in the top 10. In 2015, the World Health Organization stated that we are actually ranked number 37, right after Costa Rica. What does that tell you? It tells me we're not doing a very good job. We're not taking very good care of ourselves. Our system is actually failing us. One system that is working is emergency medical system. Because if you have a heart attack or a stroke, or you have to go to the hospital after a car accident, you have to have a life-saving procedure. We do a great job at that. But where we're not doing a great job is taking care of our chronic conditions. So the definition of insanity is doing the same thing over and over again and expecting something different to happen. So who's heard of stem cells? That's why we're here today, because we've all heard of stem cells. What's the big hoopla? Why are so many people investing in them? So first we have to talk about an amazing word, regenerate. What does this mean? To build, grow, repair, or create new tissue. The real miracle is our bodies automatically do this, but sometimes they need a little help. That's where stem cells come in. So what exactly are stem cells? A stem cell is simply a cell with the ability to regenerate in our bodies. Stem cells help reduce inflammation. They fight cell death. They're able to differentiate into multiple tissues. They self-replicate. These cells are amazingly smart. They can find areas of our body that need to be healed or have inflammation and start working to regenerate those areas. So, can we really regenerate tissue? Our bodies do this all the time. Our skin regenerates every 3 weeks. Our intestines regenerate every 6 weeks. The bad news, our bodies produce less and less stem cells as we age. If we have less of these, how well do you think our bodies are going to regenerate? Not very well. As we age, there are less and less stem cells in our body. When you are born, every 1 in 10,000 cells are stem cells. By the time we're teenagers, it's 1 in 100,000. By the time we're 80, it's only 1 in every 2 million cells. So if there are less and less of these cells, how well does our body heal? These amazing little cells have received a ton of attention. The National Institute of Health spent $1.5 billion last year on stem cells. Elon Musk and Peter Thiel, founders of PayPal, they invested $200 million of their money. Bill Gates has invested, even the state of California has invested in the stem cells. But why? We obviously know this is the future. We've known this for over 20 years. People have even gone to the point they've been willing to compromise their morals with this for the science. But why? Because at the other end, we have what it can do. There's 4 different types of stem cell therapy. That brings us to the first type of stem cell, fetal stem cell. These come from aborted human embryos. With this stem cell, at one end, it's ending a life, and at the other end, it's giving life elsewhere. But what we decided as a nation, that as amazing as these stem cells are at giving and regenerating life, we needed to find another way and other areas to do it. These are illegal in the US and should be. So what has become our options? Second type of stem cell, amniotic or placental. These are harvested from the amniotic sac, and this creates a large amount of wasted cells. These also have potential risks of allergic response and don't have verifiable amounts of stem cells. So while these have produced results, they have not been the highest level or controllable option. So there's also stem cells that you can give yourself. This method requires invasive surgery to harvest the cells. Then they reinsert them back into our bodies. There are a couple problems with these. 1, remember from the graph we looked at earlier, how many cells do we have at this point? How well do you think this is going to go? 2, our bodies are incredibly smart. There have been often times that stem cells are taken out of an area, cells are spun, the cells are re-injected somewhere else, they travel back to the site we took them from in the first place. With surgery, causes what? Inflammation. So while giving our own cells to our bodies sounds like a great idea, it's not for everyone and is very dependent on our age and health. So all of the other cells have had some success, but have had some downsides as well. That's why we brought you here today, because we do something completely different. This is the breakthrough we use, HUCT stem cells. These cells are from umbilical cord tissue of a healthy born baby and a healthy mother who volunteer these tissues. This is the safest and least invasive extraction method. And because these cells are formed as a baby, they are undifferentiated cells, so that means your body can mold and create them to match wherever they are needed. These are delivered to our patients through a simple, fast injection, so no pain. These are also customizable for each patient. Let's talk about the advantages of HUCT cells. These are amazing at what they can accomplish. One, since HUCT cells are immune system privileged, anyone can be treated. Two, these cells are anti-inflammatory. Why is that important? Why are we taking all this medication and what are we trying to treat with it? Inflammation. These also control and improve your immune system. They are our optimum ability to stimulate regeneration in our bodies. With the HUCT stem cells, we are able to inject 10 million stem cells, and each cell regenerates every 28 hours, 65 times over the first 90 days. So how many cells do you end up with? Can anyone do the quick math on that? 650 million stem cells. What do you think your healing power will be in your body when you have 650 million stem cells at work? The cells are rigorously tested and screened under National Institute of Health, American Association of Blood Banks, and American Association of Tissue Banks. We want the highest level of stem cells, and these are highly regulated. So imagine for a moment, moving again, going up and down stairs, walking with confidence, as well as just not experiencing pain. Who here would like to get their life back? So let's talk about the questions I normally get. Are there studies? A search of clinicaltrials.org provides information on over 5,300 active studies. How long does treatment take? After we determine that this is right for you, it's a very quick process that lasts about 30 minutes. Then you're on the road to recovery. Are there side effects? Just like any injection, there can be some slight discomfort at the site. We would also ask you limit physical activities and anti-inflammatory drugs so the stem cells can do their job. Can anyone guess how many adverse effects have been documented with HUCT stem cells? 0. The only side effect is you have cells that create regeneration in your body. And what does that regeneration mean for us? You get relief. So it all sounds pretty great, right? So are there any downsides? We like to be very upfront with people. Everybody's body is different, so result times vary. Remember, these cells regenerate every 28 hours, 65 times over the first 90 days. So with that amount of HUCT cells, what do you think is going to happen? You get better. So here's the question we all want to know. How fast will I see results? Typically, patients start experiencing results in weeks 4 to 6. Some sooner, some later. Remember, everyone's body is different. So question, who here has heard of a little company called Medicare? Everyone has. This is from Medicare's guidelines regarding chronic conditions, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. So let's recap. What is insurance currently covering for you? Insurance is happy to cover medications, surgeries, even your cortisone injections. But what do these do for the root cause of the problem? And if you're on medication for these problems, how long until they fix what's going on? Never. So you're buying them then for how long? For the rest of your life. So while stem cells are making leaps into the attention of the media and medical world, why would insurance not cover this? They lose customers. So insurance does not cover stem cell therapy. Most clinics charge anywhere from $7,000 up to $20,000 for injections, depending on the site. And many of those are not the highest quality or best type of stem cells. We've researched many different collection labs to find the highest cell count and the best quality for our patients. Typically with our patients, injections are a few $1,000s a joint, all depending on the area treated. All of us will age, and these moments are the times when we decide what that aging process will look like. So it is time for you to decide whether you're going to take action and take charge of how that aging process goes for you. We would like to invite you to take that next step and schedule a consultation in our office. We have well over 100 people per week attending our events and viewing this presentation. We set a few of these complimentary appointments aside per week, and availability is limited. So appointments are scheduled in order of requests received. Please call today to schedule yours.